Regarding Alzheimer's disease, which is not true. Initial loss of long-term memory, delayed loss of short-term memory, and step-ladder pattern is not true about Alzheimer's disease. What is true about Alzheimer's disease? Cognitive impairment and judgment impairment. All except are true regarding Alzheimer's disease. Abrupt onset, acute exacerbation, frontotemporal disorder, and ubiquitin Lewy bodies are not true about Alzheimer's disease. Alzheimer's disease is gradually progressive and episodic memory. Progressive cognitive impairment in Alzheimer's disease is characterized by recent memory loss. Frontotemporal dementias include all except Alzheimer's disease. So, frontotemporal dementia include Pick's disease, non-fluent aphasia, and semantic dementia. Rivastigmine and donepezil are drugs used predominantly in the management of dementia. Donepezil is used in treatment of Alzheimer's dementia. Korsakoff psychosis is seen in CRF and marasmus. The site of lesion in Korsakoff psychosis is mammillary body. Wernicke's encephalopathy involves which part of CNS? Mammillary body and thalamus. All are associated with Wernicke encephalopathy except cogwheel rigidity. So, what is associated with Wernicke's encephalopathy? Alteration in dental function and sixth nerve palsy and ataxia. A 45-year male with a history of alcohol dependence presents with confusion, nystagmus, and ataxia. Examination reveals sixth cranial nerve weakness. He is most likely to be suffering from Wernicke encephalopathy. An alcoholic person comes to your office, he can't tell his name, there is gross incoordination in walking, and his eye is deviated to one side. What is your diagnosis? Wernicke's encephalopathy. Wernicke's encephalopathy features all except aphasia. So, Wernicke's encephalopathy features are confusion, ataxia, and nystagmus. All are features of Korsakoff syndrome except defective motor skill. So, what are the features of Korsakoff syndrome? Confabulation, retrograde amnesia, and antegrade amnesia. In Korsakoff psychosis, all are seen except loss of remote memory, loss of intellectual function but preservation of memory, reversible state. So, what is seen in Korsakoff psychosis? Lack of insight and unable to understand the disability. True statement about Korsakoff psychosis is severe antegrade plus mild retrograde memory defect. Korsakoff psychosis is best diagnosed by impairment of long-term memory. All are relatively normal in Korsakoff psychosis except learning. So, what is relatively normal in Korsakoff psychosis? Implicit memory, intelligence, and language. Korsakoff syndrome true is confabulation may be present. An alcoholic presents with complaints of loss of memory of recent events, impaired insight, confabulation, and dementia of few months duration. The patient is suffering from Korsakoff psychosis. In chronic alcoholic, loss of memory and confabulation is due to Korsakoff psychosis. Korsakoff psychosis is diagnosed by impairment of long-term memory. Not seen in Korsakoff syndrome is hallucination. So, what is seen in Korsakoff syndrome? Clear consciousness, inability to learn new things, and confabulation. Wernicke's encephalopathy can be prevented by thiamine supplement. 35-year-old male comes with history of 10 years of alcoholism and past history of ataxia with bilateral rectus palsy, and he was admitted and treated. What changes are expected to see? Progression to Korsakoff psychosis, residual ataxia in 50% of patients, and extraocular palsy disappear in hour. Anterograde amnesia is seen in head injury, stroke, and Alzheimer's disease. Amnesia is found in head injury. Biological amnesia is presenile dementia. When information memorized afterwards is interfered by the information learnt earlier, it is called proactive inhibition. All are true except implicit learning is procedural skill acquirement. So, what is true? Procedural learning is from past experiences. Amnestic syndromes lose semantic memory. Implicit memory is declarative. Anterograde amnesia affects long-term memory more. Mini mental status is 30-point program to evaluate cognitive function. Total score mini Total score 3 mini mental status examination MMSE is 30. The following are the psychiatric sequelae after stroke in elderly, depression and dementia. In case of above 60 years of age, psychiatric disorder in India is mostly due to dementia. A 60-year man had undergone cardiac bypass surgery 2 days back. Now he started forgetting things and he was not able to recall names and phone numbers of his relatives. What is the probable diagnosis? Cognitive dysfunction. Substance dependence is due to all except intelligence. It is due to personality, peer pressure, and family history of substance abuse. Which of the following is not a feature of drug dependence? Use of illegal substance is not a feature of drug dependence. The features are tolerance, persistent desire to quit drug, and consumption of large amount of drug over prolonged period. Treatment is not required in withdrawal of cannabis and LSD. The withdrawal from all of the following may produce suicidal tendencies except cannabis. So withdrawal from cocaine, amphetamine and alcohol may produce suicidal tendencies. Symptomatic treatment is not required in withdrawal of cannabis. Physical dependence is not seen with cannabis. Physical dependence is not seen with LSD and then cannabis. Most commonly abused opioid is diacetyl morphine. All are seen in morphine poisoning except hypertension. So what is seen in morphine poisoning? Cyanosis, pinpoint pupil and respiratory depression. Acute opioid withdrawal is characterized by rhinorrhea, piloerection and insomnia. A boy is having diarrhea, rhinorrhea, sweating and lacrimation. What is the most probable diagnosis? Heroin withdrawal. The following symptoms may be seen in opium withdrawal: lacrimation. Yawning is common feature of opioid withdrawal. What is not a feature of heroin or smack withdrawal? Hypersomnia is not a feature. What is the feature? Yawning, muscle cramp and hypertension. Which of the following drug is not used in opioid dependence? Disulfiram is not used. Which are used? Clonidine, lorazepam and naltrexone. Naltrexone is used in opioid addiction because it prevents relapse. False regarding opiate withdrawal syndrome. Treated with naltrexone is false. What is true is it is characterized by body pain, characterized by dilatation of pupil and treated with methadone. The drug which is used for long-term maintenance in opioid addiction is methadone. Which of the following is an alternative to methadone for maintenance treatment of opiate dependence? Buprenorphine. Opiate withdrawal is treated with methadone. Naltrexone is used in opioid dependence to prevent relapse. Drugs used in heroin withdrawal is haloperidol. Methadone is indicated in opioid dependence and opioid withdrawal. Smack is the common name of heroin. All are adulterants of heroin except charcoal. So what are the adulterants of heroin? Chalk powder, quinine and fructose. In an alcoholic man, blackouts are seen in alcoholic intoxication. Most common symptom of alcohol withdrawal is tremor. Features of alcohol withdrawal are all except hypersomnolence. So what are the features of alcohol withdrawal? Epileptic seizure, restlessness and hallucination. Is seen in alcohol withdrawal. True about delirium tremens, clouding of consciousness, coarse tremors, hallucination and autonomic dysfunction. A 30-year-old male with history of alcohol abuse for 15 years is brought to the hospital emergency with complaints of fearfulness, misrecognition, talking to self, aggressive behavior, tremulousness and seeing snakes and reptiles that are not visible to others around him. There is history of drinking alcohol 2 days prior to the onset of the present complaint. He is most likely suffering from delirium tremens. An alcoholic addicted presents an emergency with irrelevant talking and disoriented to time, place and person. There is history of not taking alcohol from last 3 days and no head injury. He has also visual hallucination. The diagnosis is delirium tremens. A 40-year-old male with a history of daily alcohol consumption for the last 7 years is brought to the hospital emergency room with acute onset of seeing snake all around him in the room, not recognizing family members, violent behavior, and tremulousness for a few hours. There is history of this having his having missed the alcohol drink since 2 days. Examination reveals increased blood pressure, tremors, increased psychomotor activity, fearful affect, hallucinatory behavior, disorientation, impaired judgment, and insight. He is most likely to be suffering from delirium tremens. 46-year-old chronic alcoholic, one day after abstinence from alcohol, comes to casualty presenting with restlessness, seizures, coarse tremors. He is not able to recognize the doctor. He thinks himself in a jail. He also complains uncontrollable fear of being murdered, insomnia, and insects crawling over body. Probable diagnosis is delirium tremens. An alcohol withdrawal which is not seen. Blackout is not seen. Seizure, coarse tremor, and hallucination are seen. Withdrawal, delirium, hallucination, and amnestic disorder is seen with alcohol. Alcohol withdrawal is characterized by hallucinations. Morbid jealousy is most often seen in patients taking alcohol. Alcoholic paranoia is associated with fixed delusions. Effects of chronic alcoholism are confabulation, amnesia, Korsakoff psychosis, malnutrition. Wernicke-Korsakoff syndrome is due to the deficiency of which of the following? Thiamine. True about alcoholic dependence syndrome: tolerance, withdrawal, cage questionnaire, physical dependence. By which alcohol dependence is best indicated? Withdrawal symptoms. All are anti-craving agent for alcohol except lorazepam. So which of the following is used to maintain abstinence in alcohol dependence? Naltrexone. All of the following agents are used in the treatment of alcohol dependence except flumazenil. A 40-year-old man presents to casualty with a history of regular and heavy use of alcohol for 10 years and morning drinking for 1 year. The last alcohol intake was 3 days back. There is no history of head injury or seizures. On examination, there is no icterus sign of hepatic encephalopathy or focal neurological sign. The patient had coarse tremors, visual hallucinations, and had disorientation to time. Which of the following is the best medicine to be prescribed for such a patient? Diazepam. Drug of choice in delirium tremens is chlordiazepoxide. In an uncomplicated case of alcohol withdrawal, the drug which can be given safely is benzodiazepine. Treatment of alcohol withdrawal is benzodiazepine. An alcohol withdrawal drug of choice is chlordiazepoxide. Alcohol intoxication is a form of psychosis. Psychiatric complications of alcohol dependence are anxiety, suicide, and depression. Hangover following alcohol consumption can be treated with thiamine. Formication and delusion of persecution both are together seen in cocaine psychosis. Paranoid psychosis with cocaine is seen due to intoxication. Jet black pigmentation of tongue with tactile and visual hallucination is feature of which poisoning? Cocaine poisoning. Flashback phenomenon is seen with the use of cannabis, psilocybin, and LSD. Which is associated with flashback phenomenon? Cannabis. Amotivational syndrome is seen in cannabis. After use of some drug, a person develops episode of rage in which he runs about and indiscriminately injures a person who is encountered. In a way, he is probably addict of cannabis. Psychosis resulting due to chronic amphetamine intake most commonly resembles paranoid schizophrenia. Hallucinations are produced by amphetamine. Which of the following is not hallucinogenic? Cocaine and amphetamine are not hallucinogenic. A 16-year-old boy suffering from drug abuse presents with crossover of sensory perceptions such that sounds can be seen and colors can be heard. Which of the following is the most likely agents responsible for drug abuse? LSD.